Hi everyone, my name is Melanie Elizondo. Today I will be presenting Kristen Swanson's theory of caring. So to begin, who is Kristen Swanson? First of all, she's a nurse, has her PhD. She's also a fellow of the American Academy of Nursing. Basically, she has contributed an extraordinary amount to the nursing practice. She's also the theorist behind this mid-range nursing theory that I'll be talking about. She's a dean and professor at the Seattle University College of Nursing, and she has extensive history of being a board member on many nursing committees. Currently, she is on the chair of the board of trustees for the Swedish health system in Seattle. So she's very dedicated to the nursing practice and has contributed so much to the practice. So what is her theory about? So the Swanson theory of caring basically shows or talks about how nurses showing that they care is just as important as the medical interventions that they give. So, for example, showing compassion, understanding, and empathy is just as important as clinical interventions, such as giving medications or doing certain procedures. It is important because it considers care for the whole person, and it is the foundation for healing and care. So you view the patient as a whole person and not just as their disease or diagnosis. This theory was originated through studies that were done on providers and their patients that were going through miscarriages. So here is the diagram on Swanson's caring theory. It has 5 processes. So the first one is knowing, then it's being with, doing for, enabling, and the last but the most important is maintaining belief. These are the outcomes for the patients. Hopefully, if the theory is applied, the patients feel capable, valued, hopeful, understood, safe, and comforted. And going more into detail about the 5 processes, knowing is understanding what it's like for me. So it's the nurse putting herself in the patient's shoes, getting their understanding and their perception of their disease or their diagnosis or what they're going through. Being with is sitting down with that patient, understanding their emotions, talking about it, processing any feelings, any doubts, any insecurities or things that come up with the patients, and really being there to provide emotional support for them. Doing for is the nurses doing things for the patients the way that the patients would do it for themselves if they were capable or had the knowledge to do it. For example, if a patient is unable to clean themselves properly, it would be a nurse cleaning them just the way the patient would. For enabling, it is providing the patient education, support, and validation necessary for the patient to have the capacity to get through their disease or their diagnosis. I will talk about it more in the study, but it is basically enabling things that you are doing for the patient and having them learn how to do it for themselves. So you enable the behavior with positive reinforcement and feedback. And last but most importantly, maintaining belief is the core care process, which is basically maintaining belief, what it says, which is keeping the faith in the patient and providing them with positive support and guidance the entire way, letting them know that they will get through this and that they will come out on the other side. So how does this apply to nursing? I'm going to talk about a study that was done in 2020 by He and Wong. They did a study in type 2 diabetic patients where they wanted to see how the Swanson's care theory affected one group versus one group that just got traditional insulin education. So they were applying this theory to one group of patients and not to the other. So when it came to the knowing process, they had the nurses investigate the patient's views on insulin. They gathered their concerns, any obstacles that the patients may face. And after they got a better understanding of how the patients viewed insulin, they came up with a tailored nursing measures for the patient. So everything was specific for the patient. Being with is when the nurses in the study, they sat down with the patients to discuss feelings and emotions about the diagnosis, about having to self-administer insulin, and they made a customized education plan and goals. So they were fully emotionally present for the patient. They reassured their doubts, and they clarified any misunderstandings that the patients may have had. Doing 4, this was for administering insulin process. So, of course, at first, the nurses administered the insulin to the patient. They showed them what they were doing, and eventually they had the patients do it themselves. They provided feedback in real time to the patient and guided them step by step on how to self-administer insulin. The last 2 processes that they used in the study, enabling was encouraging the patients to keep self-administering insulin, providing that positive reinforcement and feedback so that the patients could eventually reach the goal to be able to administer insulin at home after they were discharged from the hospital. And then the last process is maintaining belief. So the nurses reassured the patients, they maintained the patient's self-esteem to give them, the courage and the strength to be able to manage this disease after hospital discharge and to be able to inject the insulin at home on their own. They assessed their capability of being able to self-administer the insulin before discharge, and after discharge, they followed up a week later via phone call. They assessed any issues or concerns that they may be having, and for those that were non-compliant or having issues, they provided additional follow-up in a week, and then community resources as well, such as home health nurses, to be able to go and help the patients figure out how to keep self-administering the insulin. So the results, as predicted, the patients who received education on insulin administration using Swanson's theory of caring had better reports of self-care abilities on insulin 2 months after hospital discharge versus the patients who received traditional insulin education upon discharge. So based on that study and real-life nursing application, this theory can easily be applied to nursing practices. For example, in my practice, I currently work as a pediatric rheumatology nurse in an outpatient clinic. We deal with a lot of newly diagnosed children who have arthritis, lupus, and other rare autoimmune diseases. So we teach patients and family how to administer different medications, and oftentimes it's very difficult for these families to deal with the new diagnosis. They require a lot of support and a lot of time and guidance through this diagnosis. And then, of course, they have to administer injections to little kids, which is obviously not easy. So that is how this theory can be applied to my practice currently. I take time to understand the patient's situation, understanding and how comfortable they are with self-administering a medication such as methotrexate, which is a subcutaneous injection. And then eventually the goal is for them to administer it at home. So we encourage patients and their family that they will be able to get through this, eventually become a part of their daily routine. And as a nurse practitioner, very similarly, can be applied to newly diagnosed diabetics who require support and guidance on implementing new lifestyle changes and self-administer insulin, just like they talked about in the study. In summary, this theory can be applied to advanced practice nursing. It's easy to understand, and to me, it's a very simple concept. And ideally, it should always be applied to nursing practice. However, it is not a perfect system, so there are many possible obstacles that can interfere with this theory being used in practice, such as time constraints. When I worked in a clinic, outpatient with adults, the nurse practitioners had 15-minute visits. So that is nearly not enough time to really get to know your patient and apply this theory to the fullest. You also have the non-compliant patients. It's very oftentimes difficult to care for patients who don't want to care for themselves. So that is a challenge in itself of applying this theory. And then the last two are lack of resources and socioeconomic status of the patient. Oftentimes, a lot of things are out of the provider's hands, such as access to healthcare insurance, money for prescriptions, or lack of transportation. A lot of these obstacles prevent patients from getting the care that they need, and because they are lacking certain resources that often is out of our control. To conclude, I believe this theory has a significant contribution to nursing because it provides the provider an opportunity to really get to know their patient, really understand them. It promotes empathy and viewing the patient as, a human, not just their diagnosis or their lab results or their imaging that you see on a screen in front of you. It's really promotes focusing on the person in front of you, getting to know them, and what can I do as a provider to help them out. Really going the extra mile to support them and guide them properly. When the patient has the proper support that they need, they're more likely to succeed and accomplish their goals. As shown in the study, the patients that got consistent support and follow-up showed that they were able to self-manage their insulin better than the patients that did not receive the caring theory applied in their education. So eventually, applying this theory in nursing practice does lead to better patient outcomes. Sometimes patients just need someone to believe in them when they don't believe in themselves. And this can also just not be applied in nursing, but in everyday life, showing that you care for someone and really going the extra mile to show support can help people go a long way. And that is what this theory discusses. And this is how it applies to nursing. And I really believe that as an advanced practice nurse, implementing this theory makes you a better provider and gives your patients the best possible outcomes. These are my references. Thank you guys for watching, and I hope you enjoyed.